Tomorrow, a big decision which impacts the people and streets of San Francisco. The city is taking another stab at trying to create sanctioned drug centers where people can easily and freely use drugs. These drug centers are controversial and have been scrapped repeatedly over the years. Here's our senior investigative reporter, Bigad Shaban.
What's become the norm in San Francisco isn't normal. Rampant drug use has left the city with one of the highest overdose death rates in America. But desperation can lead to strange politics.
We're just going to sit back and do nothing while hundreds of people are dying? It makes no sense.
San Francisco Supervisor Hillary Ronen had long been at odds with the mayor over how to curb drug deaths, even calling out the executive branch directly at a recent hearing.
We are so sick of being given the runaround, and that's what you've been doing, because you speak and you say nothing and you say the same things over and over and over again, and nothing happens, and you slam the brakes on the community.
But Ronen and the mayor have since joined forces, putting their political bickering aside in order to do what San Francisco has tried to get done for years: open what are known as supervised injection sites. These are centers where people can use their own illegal drugs under the care of trained staff who can provide medical attention in the case of an overdose.
There's a saying, in harm reduction, people who are dead can't access treatment.
For nearly a decade, Dr. Leslie Soon has been helping patients struggling with addiction in San Francisco. In the city, there were 620 drug overdose deaths last year, a slight decline from the year before, but still a more than 500% increase from 2015. Dr. Soon says there are more than 200 supervised injection centers helping save lives abroad. In 2018, we visited a facility in Canada. Research out of Vancouver found that after opening the sites, used syringes on streets and sidewalks decreased by more than half, while enrollment in rehab and addiction services spiked by 30%.
Some learning about these facilities for the first time might think, how does a place that allows people to use illegal drugs actually help them get off drugs?
When you think about it, it seems like a crazy idea, right? What people don't realize is that when someone has an opioid use disorder, an opioid addiction, it's very much a relapsing and remitting condition, in the sense that people will go through periods of wanting to get on treatment. Then in that case, the center immediately is able to linkage them to treatment and offer and really take advantage of that one moment.
So the first time they walk into that center may not be the moment they ask about addiction services.
It might be the 7th, the 25th, the 100th, but the fact that they keep coming back and, engage with a relationship with an organization, with other people, that's what saves people from addiction.
But the sites violate federal and state law. Even Governor Newsom, known for his progressive politics, vetoed a plan last year that would have allowed injection sites to open on a trial basis in select cities, including San Francisco. That legal limbo stalled plans in the city, with the mayor saying she was unwilling to move forward with the centers since they could put employees at risk of federal prosecution.
When it comes to overdose prevention programs, I want to see them happen in San Francisco, but there remain serious legal issues that have not been addressed for city-operated or city-funded sites.
But Supervisor Hillary Ronen pushed back.
The Biden administration has not engaged in prosecuting anyone. I think when life and death are at stake, I think we have to take risks sometimes, and now is the time to take that risk.
The mayor says she's no longer waiting on guidance from the federal government to push ahead. Now, in a sort of political compromise with Ronen, the two hope to copy what New York City did more than a year ago. The Big Apple opened the nation's first ever injection centers with a pair of facilities that are privately funded. No taxpayer dollars. Mayor Breed and Ronen want to bring that model to San Francisco by opening 3 centers by the end of the year. A prescription to lessen liability as the city takes another shot at addressing its drug crisis. With the investigative unit, I'm Bigad Shaban.
A couple things need to happen here. Tomorrow, a board committee will vote on whether to move this plan forward. If approved tomorrow, it moves on to the full board next Tuesday. If you have a story tip for Bigad Shaban or anyone else in our investigative unit, give us a call, 888-996-TIPS, or visit our website, nbcbayarea.com/investigations.